Welcome to The Grand Balance, a biweekly podcast hosted by two working grandmas navigating the beautiful chaos of work and family. Hi, Sharon.
Hi, Angela. We're so excited this week to be back with Sharon, our expert esthetician, who is a mother of three and a skin wellness expert with a passion for helping people feel confident in their skin. We talked a lot last week about younger skin and the effects girls are being faced with social media and TikTok trends, etc. And this week, I'm so excited because we get to talk about our skin, women 50 and up. Welcome back, Sharon.
Thank you so much for having me.
We are very excited because now we get to talk about ourselves.
And I have so many questions.
Same. We've been waiting for this.
Ready.
Well, the first question I have was actually sent in by a listener, and I already know the answer because I asked you this years ago when I met you, and you took complete control of my skin. Thank you.
Yay.
What do you feel about wipes, and are they a good thing to use or as bad as some people say?
When you say wipes, you're talking about like
makeup wipe, cleansing wipes.
Got it. Okay, thanks.
We're starting off strong with a common question that people use to save time at night.
Because I bring them when I travel because I can't pack all my bottles, so I do bring the wipes. So I'd love to know the answer to that.
I love this question because I hate the wipes.
I know you don't like the wipes.
Well, let me tell you why. And I think it's important to know why and not just to hear my opinion. Wipes tend to be a little bit aggressive when it comes to your skin barrier. So one thing we're going to talk about today is your skin barrier, meaning your natural protection that your skin has, okay? If we mess it up, if we compromise it, we end up with issues. I'm not going to talk terminology because nobody remembers, but we need to know that we need to take care of our skin barriers. Wipes, for example, will break it. They could irritate it and they can mess around with the pH of your skin. They can mechanically hurt your skin. On top of it, if we use it every day, it's going to definitely give you either irritation, dehydration, or dryness. A lot of them have alcohol in it. A lot of them have witch hazel in it, and it affects our skin. A lot of people use it for two reasons. One, too much makeup, or two, I'm just too lazy to wash my face. I think those or both. So I think those are the two top answers. And let me tell you this. You're going to wash your face with a gentle cleanser. If you have the gentle cleanser that will not mess up the pH of your skin, you will remove the makeup. You will wash all the dirt, the sweat of your skin without compromising your barrier. That's one reason. Now, if you went to a wedding and you have 3 layers of makeup and it's too hard, I'm not going to say no. Use a wipey to remove the amount of makeup that you put in your skin and then wash it off. So I'm not saying no completely, but only if you went to a wedding and there's too much makeup. But for every day, get used to the idea of you brush your teeth, you wash your face. If you wear makeup every day and it does not come off with one wash, wash again. And that way you'll protect your own skin barrier much better.
And a little bottle of safe cleanser, Angela, won't take up much space.
Well, I just have to buy the little tiny
travel size
stuff. Yeah.
Your own.
I had a question. You said something about witch hazel. Is that bad for your skin?
No, but it also depends on your skin.
Oh,
if
okay.
you are already irritated, dry, or dehydrated, you're not going to benefit from it.
Okay. Thank you for that clarification.
So for everyday use, can you just run through like the majority? I know every single person has different skincare needs, but for the average 50 to 70-year-old woman, which I know is a huge range, but can you just go through what you think would be a good skincare routine for the masses?
Yes. If you don't have any type of rosacea or like a flare-up or eczema or something, let's talk about normal aging skin. I believe in protecting during the day and treating at night. So I would keep my vitamin C's, moisturizers, serums, SPFs with no actives in the morning. And then I will make a routine at night where I can work with my actives in a smart way, where I can renew my skin. This is another concept I would love to talk to you about it, which is skin regeneration. As we age, after we're 25, 30, our cell turnover process slows down. What does that mean? When we're little, our skin cell dies, it sheds off our skin, and new cells come out with collagen, with elastin, and your own body plumps your skin. Your own body brings that collagen and elastin that will make your skin glow. As we age, that process slows down a lot, and every year it keeps slowing down. And that's why we see all of these changes in our skin, besides all the hormonal changes that we all go through at different ages. So we have to assist in that cell turnover process, meaning we need to help our skin shed the dead cells so we can come up with new skin that's going to give us that glow or that anti-wrinkle situation in our skin. I believe that at 2025, we need to start with applying different things. What could it be? It could be a strong exfoliation per week. It could be retinols at night. It doesn't have to be every day. I usually don't like everyday retinols on our skin. A lot of dermatologists do, but I think it's too much for the skin. So I like to do it little by little, maybe a night of retinol, maybe a night of just anti-aging serums, antioxidants, and hydration to our skin. So yes, our skin is going to change a lot. I like to add the cell turnover products with retinol could be good. Glycolic is another one that I like. I'm a big fan of lactic acid because of the gentle approach as well, but don't use all of them at the same time.
Okay. And are those actives? Can you define active when you say, make sure you do your actives at night?
Yes. Well, actives are going to actually do something stronger than just moisturize your skin. The actives are going to send messages to the skin that are stronger, meaning retinoids, retinol, tretinoid are a little bit more irritating to the skin. And that's why I like to keep them at night. So we're not out on the sun with like layers of retinol or layers of glycolic. It's a safer way to use all of this. A lot of them have acid names to it.
So that sounds great. I think moisturizing in the morning, vitamin C, good. SPF, good. Then at night, you do your actives. And then I do have a question on all of these other things, active things you can do. So can you talk a little bit about microfusion? Because I just bought, I don't know if it was the right thing to do, but I did see something on
Social
something.
media.
Yeah. And
Being influenced.
I'm so desperate. I'm being influenced. And I got the little micro infusion from that you could do at home.
That's what I was telling you about, Sharon, that I saw too.
So any thoughts on that? And it says you should only do it like once every 2 weeks. So I think it's following your philosophy of don't do it too much.
Can you elaborate on the microfusion? Is it needles? Is it
It's needles, yeah. The little
micro
tiny
needles?
Yeah, it's like an at-home microneedling process, I would say.
Right.
But are you talking about nano needles? Are you talking about a machine that's electric or a manual one?
No, they're little.
It's manual.
It's manual. They're like a set of little disposable nano needles, and then you just do it yourself. And then they give you new ones because they want you to use fresh needles. They don't want you to use the same.
Of course. Is it something that you roll or you push? I'm just trying
Push.
to write it
Push.
back. Okay.
Push.
Exactly. So I know what you're talking about. Now, are you breaking your skin? The needles go through
I assume I am because the needles are going into the surface of my skin.
I would say it's a yes.
anything that breaks through your skin, I wouldn't recommend you do it at home. If you put the right, I mean,
Dang it. See, I wasted all that money.
I
No.
knew she wasn't going to like the answer.
Keep
Jeff.
going. Keep going. I'm just like,
sorry, but I have to be honest.
No, I know.
That's why you're here.
Can you do it at home? Was it designed to made at home? Yes. But if you use the wrong serum or you didn't wash your face correctly and you break your skin, you have a possibility for an infection, you have a possibility of pigmentation, you have a possibility of something more than helping your skin. I would leave the nano needles to a professional. I will leave the dermaplane to a professional. I think there's a lot of great products to do it at home. If it's to penetrate skin with product in a gentle way that you're not putting your skin at risk. So there's a lot of things or toys that you can use at home that will help with the hydration. That you have your peptides, you have, oh my God, things that you can take. There's so many things out there that I would stay awake from things that could go wrong, to be honest, because then it could be just worse, you know?
Okay.
Well, and the one thing you taught me that I really appreciate is the importance of exfoliation.
Yes.
So that's something all of us can do at home and get a good exfoliator. And you've always told me, like, if you don't have time, do it in the shower. And I really value that advice because I have noticed huge differences in my skin. And like you said, it's probably because I'm removing the dead scales and kind of regenerating new cells.
Exactly. It plays a huge difference on our skin. Now, there's a few different ways of removing cells, right? You have the mechanical where you have like for example, the at-home products. You have the little beads that you massage into your skin. You have to make sure they're spheres and not you have to get a good scrub that it's going to exfoliate the dead cells with the way you move your hands. I love mixing. One of my favorite scrubs has a little bit of glycolic and it has also the beads. So I'm mixing the chemical part of the exfoliation with that glycolic and the beads with the mechanical exfoliation. So if you have time, you leave it on your skin, you let the glycolic soften the dead cells, and you mechanically massage or rub off all of the dead cells afterwards. If you really have no time, you use this same scrub to just get in the shower, wash your face, scrub your face, get out and apply your serums and moisturizers. So I believe it is very important for most people to do it once or twice a week.
And
Now,
mechanically, you mean by stimulating manually with your fingers, correct?
exactly.
Okay.
Exactly. So you have the glycolic that it's going to do its job and you're going to work on it with your fingers. Now, there's a lot of gentle retinol overnight masks. So the retinol is also going to help with that cell turnover, removing the dead cells overnight. So you don't really have to do much. Instead of using your moisturizer at night, you're going to use your retinol. A lot of people go for prescription retinol. It's a little bit stronger. I love to introduce that mixed with a moisturizer because it could be too much for your skin and then you compromise your skin barrier. So I love the gentle approach. I don't think any of this is going to get solved overnight. You have to be patient, you have to be consistent, and you just have to figure out your daily schedule. You know, not all of us have time for a facial a day. I mean, I don't. So keep it simple where you can actually just do your homework in peace, and enjoy the process as well.
Well, the retinol mask, I've never tried that. Is that something that you peel off in the morning or you wash
Nope.
off in the morning?
You wash it off. So the
Okay.
one that I work with, it has two different layers. It has the retinol that's going to penetrate in the skin and do the cell turnover, the anti-aging, and it's going to help with pigmentation and everything. But it has that hydration side that you can leave it overnight and it's going to work its magic overnight and you just wash it well in the morning.
Mm.
And it will not irritate your skin because it has that double side of like the work and the hydration,
Yeah, well, the work while you're sleeping is what appealed to me.
right?
So I know a lot of different people, it's a hot topic, but what are your thoughts on Botox?
Well, the first time I got Botox, it was just out of curiosity. I'm like, if I'm going to recommend or not this thing, I need to see what it looks like. So there goes crazy me, gets Botox. To me, it's not such a big deal. Again, if you don't like it, for most people after 4 or 6 months, it's out, it's gone. It is a natural protein that's injected to you. It we have this research and the years of experience, we haven't seen much problem to it. And actually they're finding more uses to it. So the younger you start, the more you prevent the wrinkles. It will prevent your muscles from moving so much that you will prevent the wrinkles. Now, a lot of people want to stay in the more, I hate to use the clean and natural side, but this is not a toxic that it's going to like destroy you. You know, it's out of your system a few months if you don't like it. It's not like back in the day they used to inject things. I'm not going to say brands, but they used to leave things in your skin. And if they would move around, that's it. It will look funny. Or if they injected too much into your lips, that's it. You can't do anything about it. So for Botox, I think you can go very little to begin with, get the feeling of it, go to a person. I wouldn't pay Groupon or, you know what I mean, like a cheap place to do it. I would go with someone that has the experience because I mean, it is something that's going to change your skin, you know? I personally like it. I also don't get it done every 4 months. I give it time. And then when I know it's faded away and I see that my skin needs it, I go and I get it done again. Again, I always tell my practitioner to go simple. Don't want to look like a Barbie doll that can't move her face. I want to be able to smile and I want to be able to, I don't know, move my face so I don't look all plasticky. So I'm not against it, but I feel like it's a very personal opinion when it comes to it. I think it's not the worst to like try it and see how it feels. For me, it's more the fear of needles, to be honest.
See, and I have the same thing. I have a fear of needles, but I feel like it's the
Tiny.
adult version of the social media on the kids because we see other women that they have no wrinkles around their eyes and then we feel self-conscious. So then we need to follow and we go get them.
I think it goes back to what she said. It's a personal decision.
Right.
And that's what it has to come
But
from.
it's that same
The pressure.
It's the same pressure.
At the end
Well,
of the
all
story,
my friends don't have wrinkles and I have wrinkles. Crap. Now I'm going to have to go get it and I'm afraid of needles. You
no.
know, so
At the end
it's
of the
stressful.
story, you have to love your body. So I have what it's called the legal wrinkles, which are my I smile wrinkles, and the not so legal, it's my frown wrinkles, you know? Like I want to see my smile wrinkles around my eyes and around my lips and everything, but my frown, I can work on those, you know? They're not
That's
so
right.
pretty.
That's where I am too. The
That's
middle,
my
the
person.
11s between your eyes where you frown. That's the
Exactly.
one that gets me.
Those are really bad for me. And there's people that really don't move their face because that's how they are. So you won't see it, not because of Botox, because they don't move their face.
And
That's
yeah,
how they
I'm
are.
not blessed with
That's
that. I'm
not
very
me.
expressive. Yeah,
Exactly.
exactly.
That's not me. And if it bothers me, I'm gonna go fix my 11s and leave my smile wrinkles alone, and that's fine. Petrified of needles. My hands will sweat.
Me too.
Botox could fix that, the sweat in your hands, the overperspiration. So there's a lot of things you can do with it. The needle is tiny. If they do it right, you barely feel it. And if you don't like it, you don't do it again, and your face goes back to where it was, and you are good. Now, they found so many other benefits to it that a lot of people do, like other uses besides just skincare. So it's a pretty safe toxin to use. I know toxin is not the right word, but that's what it is.
Right.
And I feel like it's a tiny needle. I feel like if you do it once and you don't like it, you don't do it again. Just follow the instructions that you need to follow, and it's more buzz than what it is. You know what I mean?
Right. Well, going back to that whole social media pressure, a lot of times when you go to a place that does Botox, they recommend all kinds of expensive lasers. Are those valuable? Are they worth the money? Are there like what are your thoughts on all the lasers? I know there's a wide range, so maybe
Huge.
you can just kind of give our audience an idea of
Yes.
if lasers are good or bad.
Well, there's a huge range. I try to divide them in two different ones just so you guys can have an idea. I have lasers where I don't because I'm not a doctor. I'm just an esthetician, so I cannot perform lasers in California. I stick to like nanoneedling, LEDs, dermaplaning, peels that are also very strong. But there are some skin disorders or certain situations where you need something more than just the topical. And that's where we get into our lasers. There's two different kinds. There's the ablative, which cuts through the skin. It opens your skin. And there's the superficial. So the superficial lasers, and again, there's different brands, there's different types, but the superficial ones, they work, they do the job, and they're a little bit more gentle, maybe a little bit less painful, less downtime, but they do work. They're less expensive. And you have your ablative ones. There's the CO2, the Morpheus, it depends on the brand and the state that you're at, but just think as ablative, non-ablative and ablative.
Right, and
So
the ablative ones are the ones you normally hear about that are expensive, and a lot
yes,
of influencers are doing those.
yes, because you see a bigger difference. You will see a bigger difference at the ones that stay on the surface of your skin. I do like them, but again, they are invasive. So it's again your personal. How much do you want to change your skin? How fast do you need to change? Or can you do a more gentle approach? I like to get my patients into peels and work my way up to like stronger peels where you can see a big difference. And yes, it might not be in 1 or 2 weeks, it might take months, but you can get to a very nice spot. You know what I mean? It depends what you want to work on. It really,
Right.
and it depends if your skin has been compromised. So if we're talking anti-aging, pigmentation, there's really good lasers out there, and you will see a big difference with 1 or 2 times that you go in.
I've actually done laser treatment. I had cherry angiomas all over my body. Do you know what those are, Sharon? The
Yes,
little red little
yes,
dots
I
all over
do.
your body?
I think
Yeah.
they're cute.
It got out of control, and they said it gets worse in the sun. So I'm
Yeah,
laying in the sun, and all of a sudden I just break out, and that laser was very effective for that.
yes.
And
But was it
then
ablative? No.
I don't know what it was, but it felt like it was snapping rubber bands
Yes,
at me over my
yes.
whole body. So
I have an idea of which one might have been, and it's not. And I think it's the same one that they use for varicose vein,
okay. So anyway,
spider veins.
it was very effective, but again,
Yes.
I was so worried about going outside that I did it, and I was
Yes.
happy with it.
Yes.
And then the second was with melasma. So
Mhm.
I had really bad melasma at a
Mhm.
certain part right on my forehead, and I
Mhm.
tried every topical cream you can imagine, and it just wasn't going away. So I did that, and it also was effective. So I
Yeah.
think if you get to a point, like you said, where you
You're done.
try and try and try and you're done trying, like, it can be effective. It's
It's a
not
quick solve.
inexpensive, but it's worth it in the end, I think.
Yeah,
Exactly.
good point. Well, I have a question. I every day mix in collagen to my cold brew
Okay.
and hopefully to help my skin and my hair. Is that am I wasting my time and money?
Well, it depends. Is it hydrolyzed? Do you know if it's hydrolyzed or what's
I just bought some last night, hydrolyzed.
Yes, hydrolyzed. And it has
that's
But
usually
it was pills, it wasn't
oh, mine's
powder.
powder,
Yeah.
but and it has some protein as well.
That's a good mix. Well, collagen is very interesting. A lot of creams and products that say they have collagen, the particle size of the collagen is so big, it really doesn't get through the layers of your skin. So if you use it topically, I could promise that it's not going to do much of a
What
difference.
about this powder that I'm
Yeah,
mixing
That
and
in?
the pills.
exactly. I'm happy to hear it was hydrolyzed because that's the best collagen to take. It absorbs into your skin, and I mean, everyone's gut is different, but you can also mix it with different vitamins to help it absorb into your system. Your body's going to break it into like small peptides when it's inside the system. You know what I mean? So it's going to be easier to absorb. Now, it's not only going to help your skin and your hair. Some people have talked about feeling different in their ligaments, or like, I don't know if their knees were hurting, or, you know what I mean? Joints were hurting. And they also say that it's going to help with that. Why? Because when you drink this thing, the powder, it turns into the peptides, and those peptides are going to also help stimulate the increase of your own collagen, elastic hyaluronic acid. So it's like waking up your own system. So it's not something that you take and it shows up. It's like, oh, it's waking up my system. It's waking up my cells into producing this, you know what I mean, effect of wake up call. If you see it.
Yeah, and I bought it for the joint
Yeah.
for
Well,
the
Yeah.
joint pain, so I'm glad it has dual
And there's
purpose.
different types. There's like I know there's like vegetarian types, and there's bovine that's also like good for skin. I know there's like marine sources, those smell a little bit funky. It absorbs nice. They're a little bit more expensive, but they're still good. When my clients take that, I recommend two different brands. one of them's already mixed with the vitamins. But if look at the label of yours, if it's not combined with like vitamin C or zinc or something, check with your always with your what's it called with your doctor if it's safe, and mix it with like a vitamin C or like a zinc to like increase the absorption.
Okay, so Angela's what she was talking about, the hydrolyzed was pills. Mine is the Orgain collagen peptides and probiotics, hair, skin, nail, joint,
Hmm.
gut support. It doesn't look like it's hydrolyzed, so that's a bad thing, right?
It would well, it's not a bad thing. It's just going to be harder for your body to absorb.
Okay.
Mhm.
Which, yeah, that's funny because way back when I was always from the whole side, like, I don't need these expensive products. I'm going to buy my Neutrogena and be happy from the grocery store, Target brand. So I did that while getting facials. This was actually in preparation for my daughter's wedding several years ago. And finally, what clicked with me personally was you said, why are you taking care of your skin and then buying these products that your skin can't even absorb because they're not going into your skin? And I like that for some reason, a light bulb clicked. And I thought, yeah, you're right. If it's not absorbing, it's not doing any good, and I'm wasting time and money overall. So that I'll
Yeah.
always remember because it was such a prolific thing you said to me.
Yeah, and on your case, if we can talk about it, I feel like it was also irritating your skin. It was not only not penetrating, but I would see a little bit of the irritation from the products.
Right. Well, and I have very sensitive skin in general.
So we had to fix your skin barrier too.
So we talk a lot about the face, and I had mentioned I had, the laser on my body. What can we do as older women for the rest of our body? Because
Sagging skin.
yeah, sagging skin, just discoloration and all of that stuff. Since I think we've just spent so much time on our face looks amazing. But if you were to look at my hands, I look like a 90-year-old woman if you just saw my hands.
Yeah, usually I when I can't guess someone's I love trying to guess people ages. And one way that I play with is by looking at their neck and their hands. So, the same thing you are thinking about your face, do it to the rest of your body. So, for me, prevention plays a big role. If you're
Too
going
late.
to Exactly, but if you're
Okay,
going
so talk about prevention first, and then we'll talk about now what.
Exactly. So prevention, right? We're going to try to get our sunscreening. If you're going to be driving in for hours, maybe you want to buy those gloves that will cover your skin. Or maybe you're just going to do SPF on your skin. Now, you can do all of these lasers and the peels and everything. I try to apply it to my clients on their face, neck, and part of their chest, just because it is exposed to the sun, same as the hands. So sun exposure is a big one. Now, if we look down and we don't like what it sees, same idea. You have to hydrate, you have to exfoliate, you have to cover from the sun. And for me, it's a lifestyle overall. So you have to look at your diet, you have to look at your sleeping habits. I mean, a lot of us are doing lots of dishes a day. So what soap are you using? Is it harsh? Is it too strong for your skin? Use gloves when you do the dishes. I know it's not easy to get used to, but try to protect your skin from the chemicals that could dehydrate, that could do that. Now, if you want to fix, because we're talking about prevention, but if you want to fix it, I would work on maybe putting on gloves or maybe hydrating our whole body. There's something called dry brushing. When you buy this brush, you brush it towards your heart, legs up, arms towards your heart. And we're going to stimulate cell turnover, but we're also going to stimulate a little bit of our lymphatic system. That's another system that needs work when we age. So we want to wake it up. Dry brushing, it's a good, gentle way to do it.
Oh, I love this because I don't think about my hands. I'm going to start using gloves for dishes, putting sunscreen
Driving.
on my hands, which I never do when I drive.
When I put even my night cream on, the retinol,
Mhm.
would that help my hands? 'Cause I
And
feel
your
like
neck.
in my
Yes.
neck, because I do put it, like, the remaining on my hands. I
Oh, smart.
consistently
I never did. And now I guess it's time to start doing
Yes.
that.
yeah.
And I mean, it's our hands. I've had also people dealing with after pregnancies. A lot of people deal with like spider veins and vertical veins, and they are painful and they're uncomfortable. Like you said, there's lasers that you can do in your body. If it's not fixed by the laser, you can do injections. They hurt, they burn, but they fix that. You know what I mean? So if we're talking about, you can talk about the toes. Same idea. We need to start taking care of it, getting rid of the dead cells, hydrating. I would give our bodies a break. A lot of us love the getting manis and pedis, but also give yourself a break from the chemicals of the nail polish. So once in a while, if you don't have big events or something, give your system a break from the toxicity of the nail polish. That's also
Oh, that's a great tip.
I have been having my toes painted. I do it myself, but for so many years.
No, I'm going to say I'm 40 years in and my toes have never been bare.
But my toes, my bare toes are ugly. Like the nail beds and or the nail themselves
Yeah, same, but
are discolored now.
we
So
should
I
do
don't
that in the
think,
winter.
I
now,
guess.
well,
I'm embarrassed.
it is, but I mean, I'm going to give you some advice. You can buy yourself a nail oil or a nail treatment. You give your nails a break from the toxicity, but nourish them. There's a lot of oils or nourishing products that we can use on our nails. So they're going to be a little bit prettier. And sometimes they get to this point because we don't let them breathe. So
That's what I'm thinking. That's why my nail bed looks so bad is because it's never exposed to air.
exactly. So you
Okay,
need
nail
to
oil. That's
let
good. I
them
never know
breathe.
that.
Buy yourself product for your nails. Make sure you're doing your SPF. And if you're going to deeply exfoliate your feet, you don't be barefoot or in sandals or flip flops the whole time. Maybe you're going to wear some socks. There's some socks that they sell that you can use with moisturizer at night. So if you hate sleeping with socks on, you put them on for 30 minutes and then you take them off, but you go to sleep with your skin hydrated, your nails clean with a little bit of that nourishing oil. I have some of my mature skin. I had one lady come in and TMI, but she was dealing with a lot of zits in her butt.
Mm.
She's like, it's so horrible. But I'm like, well, it's normal because it's skin that doesn't breathe. They sell lactic acid moisturizers that are not expensive. They're actually designed for the body that you can apply on these areas. Same idea. You shower at night and you have your arm bumps or the bumps on your arms or the bumps in your butt. And you can put a little bit of not inside the skin, but you know what I mean? The
Right.
external skin and let that lactic acid assist your skin to remove all of this for a smoother skin.
Oh, I like that routine. I need to change up my routine. I just learned.
There's
Yeah.
always more and more things that you can do that could be very simple, and not everything has to be so much time consuming,
Right, that's what I'm thinking.
Simple.
Simple and inexpensive, but
Yeah.
just a change I hadn't thought of. Like, definitely when after summer, I'm gonna get all the nail polish taken off my toes and just maybe get a really good pedicure with no nail polish and use the nail oil and moisturize at night and get my feet in tip-top condition.
Yeah, give them a little break. They need it.
Yeah, great advice. One thing before we leave I wanna talk to you about is we have a big audience of mothers going through the motherhood era or
Yes.
our girls. What kind of tips can you give busy moms to keep their skin routine going well, but not very time intensive or expensive?
Keep it simple. Because if it's not simple, you're not going to do it. Sometimes we are exhausted. We can't even think. So for me, it was to have the product where I need it. I have a cleanser next to my sink. I have a cleanser in my shower. So if it was inside the shower, outside the shower, I knew I was going to wash my face. It's very important if you're not going to have time to remove your makeup, don't put any makeup on so you can prevent the later on congestion of dirt in your skin. Now, it is important to get into a small routine, but be consistent. Remove the dead cells, cleanse your skin, and also listen to your skin. You're going to go through so many hormonal changes that you might end up with a different skin. My skin now, after having kids and before, it's a completely different person. My skin during the winter and during the summer, completely different person. So pay attention to the changes with your period, pre-pregnancy, post-pregnancy, even perimenopause. It's going to change and you need to adjust your skincare routine. If it's more hydrating, if it's less hydrating. So that was one of the reasons I went into studying skincare because it was so big, so many opinions, so many things that it was so overwhelming. I wanted something simple that worked and that you could see the difference.
What do you think about those light masks?
The LED?
Yeah.
Well, You have to learn how to use it. I think it's pretty safe to use it once a week or every 3, 5 days just to be safe. But make sure you're using the right one for your skin. And you can probably chat GPT or Google this, but depending on your skin, look for the color. So a lot of people are using just red and blue. And there's also yellow, there's also green. There's different colors that have a different approach and that have different side effects. So if you're not willing to do the research and study what it does, go to a professional, don't mess around with. I do like the benefits of the anti-inflammatory. I like the benefits of the blue one for somebody that has acne and we just did extractions on them. I believe it's important to apply it to your skin with a clean skin. So do a little bit of a study before you buy one of these devices and make sure the color that you get, if it's not one that changes, it's good for your skin.
Oh, okay, good.
Great
It doesn't
advice.
worsen.
My daughter got one, and I don't know if it changes colors or what, but it's good advice because I'm gonna look into it now.
And I never thought about the importance of putting it on clean skin.
Yeah,
It
yeah.
seems like very commonsensical, logical, but like you
'Cause
need to be
you wanna make
completely
sure what's going through your skin, it's, I mean, clean and you know what I mean? And keeping it safe so we don't end up with, like, a skin condition that's new.
right.
Okay.
Speaking of hormonal changes for menopause, I know many of our audience is dealing with menopause or has gone through it. Generally, does skin get drier through the menopause period, or is that not necessarily true?
Well, like I said, everyone's different.
Okay.
Within the first 5 years of going into menopause, we lose 30% of our collagen.
Ay, ay,
You
ay.
will see sagging. You will see the, like, the fine lines getting deeper and deeper, and you'll see the wrinkles. And I believe that that's when you want to look into, like, the lasers, and you want to do a little bit of, like, stronger peels or take care of speeding up the cell turnover that we were talking about
Okay.
earlier. Now, I know that I've had to transfer some of my patients to dermatologists because they could get very thin or fragile skin. And that's when you want to go to, like, a dermatologist and see if you're a good candidate, because they are some creams, topical creams, that have some estrogen, because that's what we lose with menopause.
Oh, okay. Good advice.
When if it's thin and it's delicate and you're bruising very easily and it's sensitive, that's when it's like, okay, maybe I need to look into something more than just cell turnover, and maybe I need to add the estrogen into one of your moisturizers. Now, you're talking about feeling dry or dehydrated or like a rougher skin. Is that what you're?
Yes.
Yeah, because we also reduce our oil production, our own natural oil production. So that's one good point where you can start layering your serums, your moisturizers. So instead of just doing the two-step in the morning and the two-step at night, very likely, I especially recommend a serum in between cleansing and SPF, or cleansing and moisturizer. I like to add the serums. I like to add the eye cream because the skin around our eyes is so thin that we need a little bit extra help around the eyes. So that's when you add things up, if it's your estrogen moisturizer, if it's your eye cream with certain vitamins or with caffeine or speeding up the cell turnover. So there are a lot of things that you can do, but always not compromising your skin barrier, always working with cell turnover. You have to be very careful when it's more mature. You have to be careful with inflammation, eczema, rosacea. You don't want to cause a flare up. So you have to stay within your skin. So I always recommend listening to like going to a professional, get their opinion, not always like the salesperson on Sephora.
Yeah, no, that's
Right.
perfect. And just to remind our audience, Sharon did talk a lot about skin barrier in our prior episode. So if you haven't listened to that, please check it out because that was really valuable information I didn't know about either.
Yeah, yeah.
So I guess we have to wrap it up. We could talk to you for hours because this is
Oh, for
very
sure.
interesting to both of us. But we so
I
thank
love
you
it.
for your time. And we hopefully maybe we'll have a check back and get more information in the future with you and continue the skincare journey.
Anytime, I'm always here.
Oh, thank you so much. Thank you for listening.
Thanks, everyone. Have a great
Thank
week.
you.
Bye.
Bye. Before you go, if you're interested in learning more from Sharon, follow her on Instagram at Skincare by Cher. That's SHAR. Skincare by Cher. Thanks again, everyone. Take care.
Thank you for listening. Please like and subscribe to the podcast so we can continue to grow our community. Also follow us on Instagram at Working Grandmas Podcast, on Facebook at The Grand Balance, a Working Grandmas Podcast, and join our LinkedIn group, Working Grandmas. You can also email us at info@workinggrandmas.com or message us through any of our social media platforms.